Welcome to this lecture on the development of the lungs or respiratory embryology. So this particular lecture will go through three main learning outcomes. Number one, we will learn how we go from the lung bud and we can go all the way through to creating the lungs. Number two, we'll have a look at how the pericardial and pleural cavity will form. So that's the formation of the thorax. Number three, we'll look at how the diaphragm forms. All right, so firstly, let's go across to this image. This is a fetus or a developing embryo. It's in a sagittal plane, so we can see the head here. We can see going down into its midgut and then going around to its latter end. What we can see, this is the eye, and moving through this big blue tube, this is what we call the gut tube. So the gut tube will go from the mouth all the way down to the cloaca. What we can see is it's wrapping in this kind of worm-like fashion. And sitting out the front here will be the umbilicus. So this is going to be the part where the actual midgut will actually go and herniate outwards. Okay, and then coming down to the hindgut, we can see where both the urogenital and the lower hindgut will form this cloaca, and then the vitelline duct can actually go out. The allantois can go out also with the umbilicus at one point in time. Now, the blue tube, which is the gut tube, this is essentially going to be broken into three parts: the foregut, the midgut, and the hindgut. Now, as we can see here, we're going to focus more on the top end, which is the foregut. And so we're really worried or focusing on from about this point to this point. This is what we refer to as the foregut. Now, this derivative is all endoderm, so it's all endodermal tissue, so anything that comes out of this blue tube will be endodermal in origin. Now, right down the bottom we can see where we have a liver growing out, so the actual, from the front of the gut tube is what's going to form the liver with the gallbladder, and also at the back we've got the pancreas. Now, what's going to come out of the front right here is going to be the lung bud. So the lung bud will pop out at the ventral end of the ventral side of the foregut, which is going to be up towards the larynx, and that's going to be the lung bud, which we'll cover over there in a second. The last thing I want you to just pay attention to is essentially we're going to form the start or the precursor of the diaphragm. So there's a structure, a mesodermal structure, that will kind of come from the head end and migrate down in front of the embryo and then start to grow. So it's going to go down here and then start to coalesce in this area here, and that will allow the liver to grow up into it. Now, this structure in the embryo is known as the septum transversum, and this is going to be a very important structure for the developing diaphragm. The septum transversum comes from the cervical area and it's going to migrate down, so it will pull its nerve with it. Comes from the myotones 3, 4 and 5 in the cervical, and so that's going to bring the spinal nerves down with it, and so the diaphragm from that point in time will be 3, 4 and 5 innervated. So this is going to be essentially the phrenic nerve. This septum transversum is essentially this area here. So, just getting a bit ahead of myself, if we do a cut through here like so, what we're going to see is sitting out on the front wall out here. These are going to be the ribs and the anterior abdominal wall. Now, sitting in here is going to be that septum transversum. So all of this structure is going to be developing the septum transversum. So what we're doing here is we're essentially looking up into it. So the liver would develop into there. Okay, this is the anterior, this is the posterior, so this is going to be the vertebra, and these are going to be the muscles, the hip flexors, and this is going to be other parts of the diaphragm, but we're not going to focus on this point in time. This is just going to be the septum transversum, so just coming around the front. So all this area here is the septum transversum. So I'll pause that for a second and we'll come back to that. But we're going to move over to here and look at how the lungs are starting to develop. So here's the foregut, which is this part here. Coming off the front, like we saw there, this is at the 4th week. So we have what essentially we call the lung bud. So at week 4, we have a bud coming out the front of the foregut, and this is known as the lung bud. So this is the first main part, the first area of development in forming the lungs. So all we're seeing is the foregut. Coming off the front is the lung bud, and we can see the two tubes there. So tube 1 to tube 2. It started as one, but as it starts to come on, we have this tracheoesophageal septum forming, closing until it's totally separate, and we've got two separate pipes. So sitting up here would be essentially the larynx or the laryngopharynx, and then we're going to have a back tube, which is the esophagus. Front tube is going to be the trachea. So this is separating in that tracheoesophageal septum, and that's going to close off. That will give essentially the front pipe, which is going to be this coming through like so. So that's going to be the trachea. Remember, this is coming off the endoderm, so all of the trachea, bronchi, etc., the inside lining is going to be endodermal orientation. So other things like cartilage, muscles, connective tissue will have to come from the mesoderm, migrate into it. So we've seen it separate off. Okay. Now this will continue to bud off. So we can see that one bud is now continuing to another division, which is going to be the primary here. So we're going to have the left primary and the right primary bronchus there. And then that will come down and we start to have a secondary bifurcation like so. So if we do a kind of a cut through like this, okay, this area of development is going to be called the lung bud development. And that happens about 4 to 5 weeks. So what's happening between the 4th and 5th week is the lung bud forming the trachea, and then bifurcating further to give a left primary bronchus, a right primary bronchus, and then you might start to see a secondary here and here. But that's the end of this part, and that's over the 4th and 5th week. So the next development to happen is going to be the next divisions. So I'll do this in another colour. And so this is going to kind of happen through like so. Okay. This division is known as the pseudoglandular phase. So pseudoglandular. And so this is happening at about over weeks 5 to 16. All that's really happening here is further divisions of those primary bronchi. So on the left side, we'll just focus on the left primary bronchus. It's going to develop further into these two secondaries, and then we're going to have the final, what we call the bronchopulmonary segments, and there's approximately 8 to 10 on each. Well, there's definitely going to be 10 on the right side, and probably 8 to 10 on the left. So we can see further divisions here, 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 and here. So we've got 1, 2, 3, 4, 5, 6, 7, 8. As I said, it could be slightly controversial. Some might say there's 10 of them. There's definitely 10 bronchopulmonary segments on the right side, but on the left it could be argued as 8 to 10. Remember that on the left is the heart, so we do lose a bit of space for lungs on the left-hand side. So this is really happening over 5 to 16 weeks. This is called the pseudoglandular phase, and all we're really doing is further dividing those bronchi into smaller segments. And that's where it ends through like so. So now moving to the next phase, and this is going to go through to here like so. And this is called the canalicula. Now this phase is essentially going to further divide the bronchi, but it's going to be into the terminal bronchi. And so this is really occurring between the 16 to 26 weeks. And what we're really doing here is we're going to the point where we end the conducting system. So we're going to go from really conductive airway to now gas exchange airway. So in the canalicula phase, which is ending kind of here, so we've zoomed in on this point, so that's going to be ending there, which is essentially there. Again, all we're doing is further dividing the lung tissue or the bronchiole into finer points. So So we can see we've divided it further there, there, and there. And then finally, we divide into probably 3 to 6 parts on each division here. So 1, 2, 3, 4, 3 to 6 parts, and that's going to move to the respiratory bronchiole phase. And so really, it's just, we're going to be zooming in on one of these, which is down here. Okay, and that respiratory bronchiole is where the gas exchange occurs. This is again happening over the 16 to 26 weeks. Okay, and in this canalicular phase, there's no area of gas exchange. It's just producing the final divisions until we get to the final points where we find the alveoli. Moving down, I'll change colour again. So we're kind of going to go through to here. And this is called the saccule phase. Saccular. Okay, or terminal saccule phase. And so this is getting to the point where we've got the respiratory bronchioles. So we'll zoom in on this area. So we've come in through like so. This area is the canicular phase. But as we come to these areas, which are going to be the respiratory bronchioles, we're going to start to push them out and essentially form grape-like structures, which are the alveoles. Okay, and these are going to be what we see here, 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 and here. And so this is kind of like a blind pouch end, and they will start to elongate outwards like so, so like bigger grapes. Okay, and in this phase, so this is about 26 weeks to birth. 26 weeks to birth. What's happening here is right at the end of the alveoles, those cells will start to flatten off and they start to form what we call a type 1 pneumocyte, which is important for gas exchange. Also in this phase, we're going to start to develop the type 2 cells, which are important for developing, creating surfactant, which is important to keep the airways open. But essentially, we're just further dividing the respiratory bronchioles into the blind pouches, which is the saccule or the terminal sacs, which is then going to really allow the final phase, which is the alveoli phase. And so this is really just this final point here. That's called the alveoli phase. And this is really going from the last few weeks of prenatal into birth and then birth postnatally. So it could be 36 weeks all the way to maybe 8 years of age. And so in the alveoli phase, what we're doing is as the chest starts to get bigger, the alveoles will start to enlarge out, and that will increase the gas exchange regions of the lungs. Okay, and so this is really all the stages that's occurring for lung maturation. At the 4th to 5th week, what we saw was the budding occurs, so lung buds start to pop out, which gives a right and left primary bronchus. That's over 4 to 5 weeks. And then from weeks 5 to 16, we see those primary bronchi separate into secondary and then into the pulmonobronchial segments, which is on this side 8, 10 on the right. And you can see those there like so. So that's the pseudoglandular phase over weeks 5 to 16. And then we further divide each one of those pulmonobronchial segments in the canalicular phase, which is going to go to the terminal bronchi. And so that's happening from week 16 to 26. And that's just further subdividing those bronchi. This is all conductive airways. And then moving down here is the gas exchange airways. So moving to the saccules, this is the end of the respiratory bronchioles. Okay, this is where you're going to see gas exchange occurring. And the terminal bronchioles or the terminal saccules is kind of an end sac, and then you'll start to get the alveoles push out from that. And the alveoli phase is important from very late prenatal all the way to potentially early adolescence. So this is just as the chest gets bigger, the lung grows, further alveoli develop, more gas exchange is allowed. And just remember, in the saccular phase, this is important for the last bit of development, which is important for producing a surfactant. So any baby born kind of before the saccular phase, they're going to have problems with that development of the surfactant. One last thing I will say, going back to the bud-in, sometimes the way that these separate, it doesn't occur as well, so we can sometimes have fistulas. So where the trachea is separated from the esophagus, sometimes this esophagus is kind of a blind pouch, and the esophagus kind of goes down off the trachea. So there's a poor separation there, and so when the baby feeds, it will come down into the blind pouch and then can go back into the trachea, and then the baby aspirates, and that obviously causes a problem and requires surgery. So that's learning outcome 1, which is essentially looking at lung development. Moving now to the thorax and seeing how this developed. Now these two images are quite busy, so I'll hopefully walk you through them. Looking at this particular stage, we can see the lung bud, or the limb buds starting to pop out. So this is again about week 4. We can see the neural tube has closed, the nodal cord sitting like so. We can see the 2 dorsal aorta on either side. And what we can see here in green, we can see the gut tube, which is going to be here, and the lung buds popping off here and here. So these are the lung buds here, like so. Now, all this area, all through here, all around here is mesoderm, okay? Sitting at the front here is the heart tube. So this area is the heart tube. So just take a step back just so you can see this is cutting through like so. So this is going to be at the back, cutting through like so. So this neural tube will sit at the front, moving through. So there's the esophagus, which is there. Sitting behind will be the aorta, okay? And the heart's going to be sitting at the front, which is here like so. And this is the front wall here. So what we can see is the lung buds starting to come out like so. So this is where they're popping out, here and here. So they're going to go out to the right side and the left side of the embryo, like so. The heart sitting in front. All this area here is mesoderm. So this is what we're going to call a dorsal mesoderm. Okay, now this is actually the coelomic cavity. So this is a space here, all the way around here and here. Now remember, the embryo is kind of like a big barrel, opening barrel, and the gut tube kind of runs through that barrel. And the gut tube is going to be here, and the heart's developing in front here, like so. Now, all this space in here, which is the coelomic cavity, is the space that's going to allow the heart and the lungs to fill up into it, as well as the abdomen to fill up below. So there is a space. If you go down through like that, you actually come down into the abdominal cavity like so. So what needs to happen is, as the lung bud will start to push out on either side, it takes this tissue with it. Okay, so this is what we call visceral, okay, or splanchnic mesoderm. And that's going to be where the lung tissue pushes on it as it goes out like so. Whereas out here on this side, okay, is going to be the inside of the body wall, okay? And this is going to be parietal, okay, or somatic mesoderm, okay? Now that's important because these are 2 different layers. You got visceral on this side, or splanchnic mesoderm on this side, which goes around the heart tube, like so. And you're going to have somatic mesoderm on the outside there. Some other structures just to be aware, as this folding is coming in, we've got an important vein there and there, which is the cardinal vein. And then next to the cardinal vein is the phrenic nerve, which is important because that's going to be innervating the diaphragm. So as this further develops, this fold here is pushing in like this, and it wants to close off the heart. So the heart essentially is going to be completely closed off, and the lung tissue is going to grow out to the side and fill these spaces here. So we move to this. This is further developed, so we can see the neural tube is now the spinal cord. We can see the vertebra is starting to form on either side. This is going to be the disc. These 2 vessels are come together, and so that's going to give you your aorta. So this is going to be your thoracic aorta sitting at the back like so. we can see this tube here is now on its own, so that's going to be the esophagus, like so. There's your esophagus. And then in orange, which are the lung buds there and there, they're going to now, they've herniated outwards, and that's going to be them sitting out here like so. That's your lungs sitting on either side. Sitting, because that's coming to it like so, we've now got these two veins coming coalesced into one, and so that's going to be sitting there. That's your inferior vena cava. Okay, we've still got the two nerves there, which are going to be sitting there and there. That's your phrenic nerves, and the heart is still in the middle, like so. So now let's look at the lining. We saw that as the lungs popped out, they're going to take that visceral mesoderm with it. So this is going to be this lining here. That's going to go all the way around and around the heart itself. So around the line in the lungs, okay, like so. And so that, as you can, hopefully you can see now that this lining, okay, this lining is what we call the visceral pleura, okay, because that's come from the inner lining like so. And this is around the pericardium, so that's the visceral pericardium. Now on the outer part, this is on the outer wall now, so this is lining the outer part of the pleural cavity. That's going to be the parietal pleura, like that, and that will encase the whole heart and the out of the body wall, and so it's going to be the parietal pleura, and that's going to be a different nerve supply, and that in terms of the heart, that's going to be phrenic nerve because the phrenic nerve sits in it, and that's going to go down to into the diaphragm. So now what we're left with is the complete closure of between the thorax and the abdomen. We've already seen that the front aspect is going to be the diaphragm, the septum transversum, which is going to form the central tendon of the diaphragm. So all of this is going to be from the septum transversum. In another colour, so I'll do this, actually I'll just show you the holes. So the three holes coming through the diaphragm is going to be like so. So these are the crura of the diaphragm, and so coming through this hole is going to be the dorsal aorta at level T12, like so. Coming through in green here is going around the lips of the crura is going to be the esophagus, which is T10, and then coming through here is going to be the inferior vena cava, like so here, and that's T8. Now all the area that encapsulates this is what we call the esophageal dorsal mesentery. So all this is the mesentery that has come off the dorsal wall, and this is a component of the diaphragm that's important to know. That's the dorsal mesentery. The other part is this area here, which is the folds that we saw coming in like this. This is going to be the pleuroperitoneal folds, and they're going to come in from the side. Now initially we had a canal here which you could communicate from the abdomen up into the thorax. This would be coming through like so. So you could communicate through these holes. Sometimes they don't close properly, and you can get stomach pushes up through the diaphragm and causes a problem with the development of the lungs. Okay, but they should close off, these canals should close off with the pleuroperitoneal folds. And so that is another component of the diaphragm. Okay, and then the last component, which I'll draw in red, is coming from the muscles of the outside wall. Okay, and that will close the diaphragm on the outer lip. Okay, and so that gives the final component of the diaphragm. So the diaphragm actually has four parts to it. It has the septum transversum, it has the parts of the pleuroperitoneal folds. It has the dorsal mesentery from the esophagus, and then has muscle walls. So that's important to know because the innervation from the diaphragm is predominantly from here and out here, which is from C3 to C5, which is phrenic nerves. So C3, 4, 5 keeps the diaphragm alive, whilst these two back is probably more thoracic innervation. So the diaphragm, although predominantly is from the phrenic nerve, can also refer sensory pain to the thoracic region as well. And that's how it has come about through that region. So hopefully now from the three outcomes, we've seen how the lungs developed and matured from just buds all the way through. We've seen how the thorax opens up and develops, and then we've seen how the diaphragm is created from 4 different parts and the holes and the different components.